Today, Governor Abbott announced as of next Wednesday, he is lifting all statewide coronavirus restrictions. That includes the mask mandate, and all businesses will be free to open without capacity limits. Here to talk about this, we're going to get some perspective from someone who has been on the front lines of this pandemic. Dr. Natasha Kathuria is an ER doctor here in Austin and a global health specialist. Thank you so much for joining us. Again, we want to get some perspective because those of us who have not worked in an ER or a COVID ward during the past year really have no idea what healthcare workers have been through. So, doctor, what went through your mind when you heard the governor was lifting COVID restrictions, including the mask mandate next week?
Very devastated, very shocked with, what we've been through as a state. We've been through not just one, but two massive surges in our state, and multiple cities have become national epicenters for this virus. So we're very concerned that, we've been through a lot. We just finished surviving this Texas freeze, and there's a lot of repercussions from that we're still facing now. And I just don't think this is the time for us to be lifting restrictions when we still have a really long way to go. We're only at about 6.5 to 7% of our population in Texas being fully vaccinated. Our goal is 75%. We're not even a fraction of the way to herd immunity yet. So we really need to push harder than ever. And, we're terrified that this is sending the wrong message to Texans on, a big green light to go back to normalcy when we're nowhere near that level yet.
COVID cases and hospitalizations have been trending down recently, but the CDC again warns we could see a fourth surge fueled by new strains of the virus. As a doctor, what has it been like for you treating COVID patients during a pandemic that has now hit the 1 year mark?
It's been quite a ride. We've all been through a lot. We're very grateful to be vaccinated at this point in the game and feeling a little bit less fear. But there's endless suffering in our hospitals, and it hasn't stopped. It's become better, and our cases have gone down, but we're terrified. We've been scarred by surge after surge, and seeing countless people die, be separated from loved ones when they're admitted to the hospitals. There's just so much suffering that so much of our state and our country just isn't seeing that we are. And it's very difficult for us to go to work every day, be fighting this pandemic, and then coming home and seeing things like this happen where, we're worried that people just still aren't taking this virus seriously.
One last question.
It's been devastating for us.
What would you say to someone watching at home who may be thinking, okay, I'm not going to wear a mask anymore because I don't have to?
Our biggest goal to tell people is, wearing a mask is not to protect you. It's to protect everyone around you and every person that person comes in touch with. So please do your best to wear your mask. We are so close. We just have a few more months of keeping up with vaccinating to get across that finish line, and we need to get there together.
All right, Dr. Kathuria, thank you so much for sharing your expertise and your personal experiences with us tonight.
Sure, thank you.